Governor Baker, as we said, will deploy the National Guard to help local hospitals responding to a new COVID-19 surge from the more contagious Omicron variant. Here to answer your questions is Dr. Todd Ellerin, Chief of Infectious Diseases at South Shore Health. Hello, Doctor.
Hello, Doctor. It's great to see you. So we learned today that the Guard members will offer support to 55 acute care hospitals starting on Monday. So let's boil it down. Tell us, what's the situation inside South Shore right now, and do you need the extra help?
Ed, we are busy right now, but I'll be honest with you, our system is always busy, but there's no question. We're seeing a lot of COVID and non-COVID patients. There's a lot of the routine things that come in, heart attacks and strokes and car accidents. We have to be able to care for everyone. Things are busy. They're very busy, but we have been there before. I think it's great what's happening in Massachusetts. We do need help. Remember, a lot of it is about staffing, supplies, and space. We need a lot more of everything.
Right.
So it is. So I just want to reiterate what you just said. It's not just COVID. It's everything else in addition to COVID.
Absolutely, Maria. We've seen more COVID patients. The numbers are increasing. There's no question. We expect it to increase more with Omicron, but we've seen much higher numbers. But overall volumes are very high right now.
Doctors, nurses on your staff, of course they have families as well. It's the holidays. How are they holding up? We know that this is a lot of stress on them as well.
Maria, I'm so happy you asked that question because I have seen over the past, we're going on 3 years now, the nurses, the providers are working tirelessly every day, taking care of, again, not just the COVID patients, but all of the patients in the hospital, in our health system, including the outpatient, our ambulatory providers as well. It's been really hard, but I have to say I've seen a lot of fortitude. I've seen a lot of strength, and I see a lot of inspiration, but it is challenging.
Oh, well, we're going on 2 years. I can understand that. All right, Dr. T, let's get to the questions from the viewers. And this first one comes to us from Janet. She asks, our adult daughter refuses to get vaccinated because of one ingredient, PEG 2000. Let me interrupt the question there. What is that?
It stands for polyethylene glycol. It's a stabilizer that's in a lot of different compounds, okay? It happens to be in the mRNA vaccines, Pfizer and Moderna. It's not in J&J vaccine. But let me tell you, what I want to say to Janet is it's also in Miralax. It's in certain eye drops, toothpaste, soap, shampoos, conditioners. The likelihood is you've actually been exposed to it before. Can people be allergic to it? Yes, they can, but it's very rare. If you're questioning it, you want to go see an allergist. There's ways of testing for it.
But and you hit the nail right in the head. She wants to know, and she wants to wait and see the long-term effects of it. Is there a real health risk in this ingredient? But you're shaking your head no. She's been exposed already.
There's not. There's no long-term health risks. This compound has been around for years and years and years. And it's very common, and it's not a reason to not get vaccinated unless you have a specific allergy to that, which is rare. And then, of course, you can get the Johnson & Johnson vaccine, which doesn't contain that.
All right, here's another one. This one is from Brian. I'm an immunocompromised senior with no spleen and only one kidney. 6 months ago, I got a booster shot. Should I get a second booster shot now?
Brian, you're asking a really important question, and this is an evolving science, and it's in active discussion. What the CDC says right now is that immunocompromised patients, and Brian would qualify for that, you should get 3 doses of the primary series, and then a 4th dose 6 months later. Okay, so now we've had a lot of people, most immunocompromised patients have gotten the 2 doses, and then that 3rd dose 6 months later, so we're coming upon the next 6 months. And what I would say is please talk to your provider about this. I think it's probably a good idea. My guess is there will be ongoing boosters at some point. So, and we have to wait to see what the CDC says about these next doses.
Dr. T, thanks for your time. Great to see you.
Thank you, Doctor. We appreciate it.
Happy holidays.